While we have focused on better known conditions like cancer, diabetes, as well as visible and invisible conditions, disabilities, uh, we have also shared experiences of less well-known conditions, and today is one of those. So just to recap, we have done in the past, we spoke with Kirtida, who runs Sjogren's India, and that was one of our early episodes on a rare condition or a less well-known condition. And today we talk to Swati Agrawal, who will talk of her journey with chronic pain. We've also covered mental health in terms of schizophrenia. So the reason we focused on chronic pain is September is Chronic Pain Awareness Month, and we thought that as part of our Living Better series, we would invite Swati Agrawal, who has been living with fibromyalgia, to talk about the challenges she has faced and how she has learned to be an empowered patient. Um, as somebody said, and before we go into the topic, just a note to the attendees. The information we are discussing here is based on experience of panelists and not to be taken as medical advice. So please do consult your doctor. This session will be recorded. So if you're logged into Zoom, please post your questions on the chat. If you're on Facebook, you can ask your questions on the live feed, and one of us will be checking that as well. If you want privacy on Zoom, you can rename yourself. And as always, you can follow us on our website, on Facebook, Twitter, and even Instagram. And you can write to us at editor@patientsengage.com. So just a quick recap on a couple of definitions for those of you who are unaware. Fibromyalgia is a musculoskeletal syndrome which manifests with widespread muscle and joint pain, significant fatigue, and frequently, sleep and cognitive disturbances. And chronic pain, we found two definitions. One, when the pain lasts for more than 12 weeks, according to NHS, or Cleveland Clinic says 6 months, despite medication or treatment. So I think that's broadly, let me kind of take the focus back onto Swati, who's with us, and let's get started with you, Swati. So Swati, if you can just quickly tell us about yourself and your condition and diagnosis.
Hi. So I'm a lawyer who's currently working with an NGO called IDIA Charitable Trust. I was diagnosed with fibromyalgia many years back. It took me 2 years to get a diagnosis. So I had pain from around 2011. So I got diagnosed in around 2013. So it's been nearly a decade now of living with fibromyalgia. And I live in Delhi with my family and with my pets, two cats.
Right. And so somebody I was talking to described fibromyalgia as, like having flu every day. So, for our viewers, can you kind of describe what it means to live with fibromyalgia on a day-to-day basis, and how does the pain impact your life?
So fibromyalgia, I read someone describe it as the UFO of medical condition. It's
Mm,
something that cannot really be explained that well because it's not really identified that well. So if everybody's lived experience is very different with fibromyalgia. For me, it means I have a lot of body pain, especially in my legs and in my arms. It's a constant pain, and the pain also in my lower back, and the pain kind of exaggerates whenever there's a little bit of stress, either physical stress or mental stress. There's a
mm,
lot of fatigue, which you need to rest a lot more than other people probably do. There are maybe various associated conditions as well, such as cognitive difficulties, like you mentioned, and sleep disturbances. Then another common one is irritable bowel syndrome and things like that.
mm. Um, okay. And so what does that mean actually? So, in terms of your day-to-day does it affect you in terms of, uh, you're just getting around and getting through a day, or it only aggravates when you've got a very busy schedule?
So here I would like to, talk about something called the spoon theory, which
Mm,
is basically, suppose you have 10 spoons. Now you have to get through the whole day based on those 10 spoons. Now,
right.
if you have something like fibromyalgia, taking a shower will take 2 spoons as opposed to 1 spoon for a person. So
Mm,
it's just that your everyday normal day-to-day activities take a lot more effort and organization in advance in order to do them. Like for me, especially washing my hair is a big trouble.
mm,
So for that, I need to plan like a day in advance that today I'm going to wash my hair, so I will not have anything.
right. Right. Okay. Um, People with fibromyalgia often also have anxiety or depression. Some of them have brain fog, or also some of them call it, I think, fibro fog. Uh, how does fibromyalgia affect your mental health?
So I am also a bipolar patient. So for me, mental health and physical health go hand in hand. Talking about it more generally, so I think a major factor is stress. When you have a
Mm,
lot of stress, your body kind of cramps up, which leads to a lot of body pain. If you have
mm,
fibromyalgia, it increases your pain. Now, when you have fibromyalgia, you become a bit more isolated. Your life changes completely.
mm,
You cannot do a lot of activities which you could do earlier. Your life becomes a lot more sedentary and things like that.
mm,
Because of which, if just the reality that you're living with a chronic illness causes you depression, as well as the stress which causes you physical pain also causes mental disturbances, so to say.
right.
So that is how they go hand in hand. Fibro fog is something slightly different from depression or
Mm,
anxiety. It's closer to, I think, a physical symptom,
okay.
so to say, because what happens, it's about having cognitive difficulties. So it's difficulty in remembering words, recalling things,
Mm,
comprehending and understanding things. So it's something I struggled with earlier a lot more than I do now, because I think now I'm used to it. If you're having constant pain, that also kind of fogs your brain a bit, but
right.
it's a symptom independently as well.
Right. Right. Okay. And how does your diagnosis of bipolar affect your life, or your schedule, especially in context of the fact that you're also dealing with chronic pain?
It's not easy.
Mm,
Uh, so with what happens with bipolar, if I just want to go into it a little bit, is
sure.
that
Sure.
you have mood swings in which you go from high to low. I have bipolar too, so my highs go till hypomania, which is a more excited state for your body where you have excess energy and so on, to depression. And my
Mm,
depression is really bad. So I have personally noticed that when have a lot of stress and a lot of anxiety and depression, that's when my pain also increases. Anxiety is especially the worst. Anxiety is very debilitating. You can't go out, do anything because you're scared and anxious about everything.
right.
So during that state, if you, in addition to that, if you have body pain, then you get further restricted. So they
Right.
go hand in hand. And what happens in hypomania is that your body is kind of very cramped. It's very, uh, it's excited. It's not relaxed.
Mm,
Because of which also there is body pain.
right. Right. Okay. So how has the chronic pain and your various diagnoses affected your work choices?
They have impacted it a lot. So after college, I had joined a bank and later a corporate law firm. And that's when my pain had started with the stress of working in a corporate environment. Now I
mm,
was working in an office which tried its best to be very understanding and cooperative.
mm,
But you cannot just maintain a lifestyle where you're working till 2 a.m. on days with a chronic pain condition. So I
right.
had to, and law is a field, I'm a lawyer, so law is a field where even litigation requires you to work a lot
Mm,
and so on. So the work-life balance, so to say, it's not something which exists in your typical career choices available after doing law, whether it's litigation or corporate law. So I was very nervous in the beginning when I had to quit. I thought, I don't know if I'll get anything to do again.
mm,
And financially also, I was relying on my parents, and I didn't know if I will get a chance to be independent again. I was
right.
staying in Mumbai then.
Mm,
When I quit my job, I had to leave my house also, which I had been living in for 2 years, and
right.
pack up thing and move back with my parents. Now, after that, because I was sitting at home and not doing anything, I
Mm,
decided to go and do a master's degree, which was also very difficult to complete because that's when I had my first major depressive uh, episode.
episode. Right.
And after that, I thankfully got a job now where
Mm,
I work at the NGO, and it offers me a lot of flexibility and reasonable accommodation, which allows me to work fruitfully.
mm. So what can, in your experience, what can workplaces do to help people with chronic pain, uh, or, even other conditions? Um, yeah, so that, it gives people more choices as well as allows them to continue to work, because we do hear of many people saying they had to give up work, but you've at least managed to find the right balance. So what could workplaces be doing to make this easier for others as well?
I'll give an example of today. So what
Mm,
happened was today my cat was really unwell. So
mm,
because of I had to run around a lot, so I became really tired and I had a lot of pain. So I could just message on my work group that I'll be back in 20 minutes. I could
right,
go and rest and relax for 20 minutes and get back to it.
right.
So I know there'll be times when you can't do it. There'll be times when there's a lot of urgent work that you need to do right now,
Mm,
and like just like this, for example, this webinar,
mm,
and when no matter how much pain I am in right now, I can't say I'll be back in 20 minutes. But
right.
there, most of the time, there is no sword hanging over your head as such that you can't take a choice.
Mm,
And it allows me to work from home. Right now, most of the jobs are such that they can be done over a laptop and a
right,
phone.
right.
We don't need to insist on getting people to office. You are saving on travel time. You're saving on the exhaustion and pain that comes from traveling. If people prefer working from home, I think that's a flexibility which is very easy to offer. And I
Mm,
think it will be increasingly offered more and more
right,
easily.
right. Okay.
So
So,
that's another thing.
at your workplace, you have your colleagues know about your conditions.
Yes, yes, they do. In fact, I had a work call today in which I had to tell them that I have to leave early because uh, of this interview, and they were
Right.
all very excited.
So hopefully they're all watching as well. Uh, uh,
Hopefully so.
yeah, so I'm just letting people who are watching us know that you can start asking your questions, and if the questions fit in, we'll take it now, or I'll take them at the end. Um, So, in terms of your day, one of the issues that, again, people with fatigue and some of these chronic conditions talk to us about is the unpredictability in terms of, you know, the symptoms you'll face on a day, or the flare ups that you'll face, and planning ahead is often a problem. So, especially for things like travel, long commutes, after office commitments? How do you handle, these kinds of aspects of work?
I think a lot of my anxiety, which came
Mm,
out of this aspect because I was constantly scared of committing to do anything.
Mm.
because, or even doing anything, I was scared of going out of the house because what if I get a lot of pain? What if
Mm.
I fall sick? So, firstly, you can reduce the uncertainty by understanding your triggers. So,
Right.
for example, I understand that my trigger is stress.
Mm.
So, I know if there's a lot of physical stress, I need to kind of relax a little bit and take it easy. And also be prepared that, for example, if I have a work event in which
Mm.
I have to run around the whole day, so be prepared mentally that there will be a lot of pain.
Right.
No way out of it. You have to kind of go through with it with a lot of pain and try to do the best you can with that. Also, I think it makes sense to uh, kind of tell people around you and have anchors who know that you have this condition
Mm.
and that you go through a lot of pain. So they can come in and help you when needed. So people around you knowing about it helps.
Right.
I what else? As part of it, you have to live. You have to live with a little bit of uncertainty and maybe not overcommit to things.
Right. Right. So when you talk of knowing your triggers, have you identified your triggers, for example, and how did you, yeah, when would you be able to share?
The biggest trigger for me is stress, whether
Mm.
it's a and mental stress more than physical stress.
Right.
So I like if I have to run around the whole day, that's fine. But if I have to run around and work the whole day,
Mm.
that is a lot more stressful and painful for me. So also I know I keep my body very stiff.
Mm.
So when as soon as I start feeling a little pain, I check on that and kind of loosen it up a little bit to the
Mm.
extent that these are the major triggers for me.
Right. Right. Um, so in terms of when you say loosen it up, do you kind of do some exercises for it, or it's just consciously letting go and saying, okay, like I've scrunched up my shoulders, I'm going to release them, kind of thing.
I do yoga regularly.
Right.
So because of which I do know some little bit of exercises for arms and feet, which I sometimes do when I'm sitting.
Right.
And also there's this thing called body check,
Mm.
in which is a kind of a meditation,
Right.
in which you start from your toes till up till head, and you
Mm.
notice each part of your body and see how it's feeling. So
Right.
if it's feeling kind of stressed, I like to kind of crunch it and then leave it open, then
Right.
crunch it and leave it open, and that
Right.
kind of.
That helps. Good. We have a question. I have heard that there are certain specific pain points. Is that true, or is the pain all over the body?
So what happens is how fibromyalgia is diagnosed is that there are certain specific trigger points. And if you have pain in X number of trigger points, I think 12 trigger points or something out of them, for consistently for 3 months or more, then you're considered to have fibromyalgia. So there are trigger points. But from the trigger points, the pain that is there doesn't always stay at the trigger point. So if you have
Mm.
a trigger point in lower back, the pain will kind of move on to your legs also.
Right.
Similarly, if you have trigger point in your shoulder, it will kind of move on to your arms also, in addition to your trigger points on arms and hands. So in a way, the pain kind of stretches over the whole body in spite of it have emanating from certain trigger points.
Right. Right. So there is no specific diagnostic test, therefore. It's just based on,
It's the
and
diagnosis by elimination.
okay.
So they eliminate everything else. If there's nothing else which fits, then they diagnose it as fibromyalgia,
Okay.
which is why it's called Leo. Which I read about it. It's called
Right.
Leo.
And that's why it takes very long to diagnose as well, right? So,
I think it takes long to diagnose, not because of lack of diagnostic tests as such,
mm.
because that just it took once I went to the right doctor, it took 2 days to diagnose. It
Okay.
it takes time to diagnose because of lack of awareness about
In the medical community as well.
in the medical community as well and among us also. I didn't go to a neurologist because it was a physical thing for the longest time.
So
And
the diagnosis is done by a neurologist, is it, for
or
fibromyalgia?
a, or a rheumatologist.
Rheumatologist. Okay. Okay. The next question was, how does your condition affect your social obligations? You know, your interactions with friends, your relationships, family commitments.
So I am lucky to be in a situation where I have a lot of friends and I have larger family, which is more or less understanding of my condition. A lot of
Mm,
people are not, but a lot of them are.
mm,
So because of that, I think it helps. In a way, it's a good thing. It kind of helps you weed out the people who don't really care that much about you and who are not ready to support you during the difficult times. At the end of the day, you have a smaller group of people you interact with.
right,
Uh, who are more committed to taking care of you if needed, or open to the fact that you might have to cancel out on certain engagement and certain time
right,
related with you.
right. And in terms of relationships, we know that for quite a few people with both mental illness as well as invisible illness, forming and maintaining relationships, as in partners for life kind of relationships becomes challenging. Is there anything that you'd like to talk about that? And could
Sure.
be yours or, based on your experience with the support groups that you're part of.
Sure. So, based on my personal experience, um, and because I am not in a relationship right now,
Mm,
uh, when you are out there and you are dating people, as soon as you tell them you have an illness, most of the people tend to discontinue talking with you
mm,
because nobody wants someone who is kind of broken, who
mm,
doesn't feel like a whole. And it also comes a lot from the lack of awareness and a lot of stigma attached to it. And I remember one person asked me, "Are you sure it's not sexually transmitted?"
mm.
Like that's the level of lack of awareness
Awareness.
about it. And
Right.
also disbelief. A lot of people think you are just lazy.
Mm,
You, why did you leave your corporate job and you're working here? You're just lazy.
mm.
In spite of the fact that it's a full-time job, and
Right.
keeping a full-time job with an illness is no joke.
Mm,
So, uh, yeah. So I was saying, so there's a lot of stigma, lack of faith in you, and lack of awareness, which causes difficulty when you're engaging with a potential partner or even with people otherwise.
right.
And from my support groups, most of the people in my support groups are actually married.
Okay.
So, and their condition kind of got diagnosed after their marriage. So
Mm,
with that, what happens is again it's the same cycle. Some of them have partners and people in their family who are supportive, but a
mm,
lot of them come and say that they don't believe me. They
mm.
say you look fine, you look okay. Why are
Right.
you going to doctors?
Mm,
Doctors don't believe them.
mm.
So it's the same challenges for people who are married and already in relationship.
Right. Right. Um, yeah. You have been a vocal advocate of awareness of fibromyalgia and mental health for the last few years, right? Um, how has talking about your conditions helped you? Because that's always a question that people ask themselves, right? If I talk about this, will I be judged? Will I feel better about it? Uh, so, how has it personally helped you?
So I want to talk about what happened when I got diagnosed.
Mm,
So when I went to the doctor, the neurologist,
mm,
and he sent me for some test in which they send electric electric waves through your body to
mm-hmm,
see how you respond to it. I don't know what's it called,
mm,
and it's a very painful test. So he
mm,
sent me for it in spite of the fact I had nobody with me, without informing me what the test entailed.
mm,
Next, after that he tells me you have fibromyalgia.
mm,
So my first reaction to it was relief that
mm.
finally I got diagnosis. So I asked him
Right.
what is it? What's the treatment for it now that I have a diagnosis? It never occurred to me that there is no
No
treatment for that.
treatment. Right.
So he's like, you can go and Google about it. And this is one of the top neurologists in Bombay.
Mm,
So there I was, a 20-year-old in a different city in Mumbai, completely scared out of my wits that I have a condition which is called chronic, and there seems to be no treatment for it, and there's nobody to help. Now I don't want somebody else to be in the same situation.
mm,
I don't want anybody sitting in a doctor's room or going back home crying and completely scared with no knowledge of what is happening to them.
right.
So it's because of my own experiences that I speak about it. And also it's a whole journey. When you first get diagnosed, you are in absolute denial about it because you
Mm,
have some good days. You think, no, I don't have it. This is something that happens to others.
right.
And I went through it twice, once with fibromyalgia and once with bipolar.
Mm,
And so to come from denial to acceptance is a huge journey. And having people who talk about it and who you can associate with helps in the journey. And if you speak about it, surely you will face a lot more stigma. Like I
right.
cannot hide the fact that I have it from anybody anymore.
Mm,
Everybody knows about it.
right.
So you will face all the stigma, but you will also reach a place where you can accept it and feel good that you're using something which is supposed to be a tragedy in your life and channeling it towards something good.
Right. Okay. Just checking if there are any other messages. Um, your you've also started some support groups, and you're trying to start more. We tried to start an online community on PatientsEngage as well. uh, but when you've spoken about this, have you had people reach out to you and said, yeah, you've helped me with my diagnosis, or you've helped me with just support, or at least I know somebody else who has this and I'm not alone? So uh, again, do you have something to share on that?
I have had people reach out to me all the time since I started writing about it. I wrote about it on Patients Engaged twice, and
Right.
I've written about it on other platforms like the Better India and
Right.
White Foundation and things like that. So I've had people reach out to me all the time. Most of the time, they are asking for who can I go to, which doctor can I go to. Through my
Mm,
network, I usually try to find doctors in major cities like Bangalore, Bombay,
right.
Delhi, and also yeah, they just need someone to talk to also. Like everybody, like I said, you are very scared when you first get diagnosed, and someone to just tell that, in spite of all this, it's going to be difficult, but you'll be all right. You'll be
Mm,
okay.
mm. So what's your advice to people struggling with the condition, and what can they do to feel more empowered, more in control?
My advice is that something that really helped me and helped me in life in general, thanks to having a mental and a physical condition, is to get to know yourself.
Mm,
You get to know your body, you get to know your mind. Focus on it, because when we go on our everyday life, we kind of do not focus on our body and our mind. We are constantly engaged with something or the other.
right.
So focus on it, get to know your body, get to know your mind, get to understand what they need. They need rest or they need stimulation. You need regular exercise or you need less going to the gym.
Mm,
Like be in tune with it. And as you will get to know yourself, learn to be kind. You will go through things like doubt, guilt, isolation, all of those feelings that you will have to wait through. So, and through that you will come out stronger. I know it sounds very cliched and romanticized when I say it, but it's true. You will come out stronger. You're getting more in touch with your body and mind. And with that, also learn to be more empathetic in your life towards others as well. So when
Right.
you accept other people's problems and you do not compare it, you kind of take it as the face value when somebody is coming and cribbing about a job
Mm,
or about their boss or something bigger in their life. If you learn to be more empathetic towards them, it will help you to learn to handle your own problems and your own mental health and
right.
physical
That's a think a great advice for people. Um, I think we have one more question that's come in. You've talked of yoga already. Is there anything else that you've tried which works for you in terms of, complementary therapies?
health. I tried Ayurveda for a while.
Mm,
But the problem was my Ayurvedic doctor didn't believe in fibromyalgia. So he said it's all related to thyroid and he kept on trying to treat that. So that didn't work out really well for me.
mm,
I personally do not believe in homeopathy, so I haven't tried it.
right.
And I think massage helps a lot, like good uh, medical sort of massage as opposed to a therapeutic massage, like a pain relief massage, which is
Mm,
a deep tissue thing, helps a lot.
mm, okay.
And regular exercise is very important.
Right. Right. Okay. So just a quick recap then. Okay. So I think I kind of would like to summarize what Swati has said and the message out there. I think I really liked her get to know yourself message because I think it is important to look at ourselves first and look at the whole of, don't look at our conditions in isolation. So uh, the mind and the body are correlated. Also learn from the lived experiences of others. So, connect with someone who has a similar condition, and it helps you understand that you're not alone. Sharing and engaging with others helps. So, reach out and join our communities or any of the communities out there. Um, and I think we also need to, like Swati talked of, how sharing her condition with colleagues at work uh, allows them to give her space and help her to manage. So I think that's again the message of interdependence, which we really should be considering because it does help people. And okay, I have one more question before, but let me just finish mine. So do not also for others who are with people with invisible illnesses, do not dismiss the pain and symptoms of people with invisible illnesses. I think we need to all understand where it's coming from. And I have one final question that's come in. Does diet play any role in the management of fibromyalgia?
I think it's very important for everybody to eat healthy. And if you have a health condition, it's more importantly so. But it's not gonna cure it or you know
Mm,
you can't do away with pain with it. But a lot of people go gluten free if they have fibromyalgia. A lot of people give up on sugar,
mm,
and it's better to avoid fried things. Anything inflammatory is better if you avoid it.
right. And also, I guess if you say that you have comorbidity of IBS, then
Hmm.
anything that affects the irritable bowel syndrome. So therefore,
Yeah,
eating healthy would be important as well.
yeah. Like for me, it's dairy, so I avoid dairy.
Right, right. So yeah, don't forget to follow us and to write in to us with your feedback on what you want us to talk about in our next webinars or your experience. And uh, please share these videos, because you never know when it will connect and reach somebody who really is in need of seeing this message and seeing this interview. So once again, thank you, Swati, for taking time
Thank
and
you.
doing this. I know you've been having a very busy schedule, and but you've been a great stalwart and a patient advocate. So I think I'm sure you've helped a lot of people. I've personally learned a lot about fibromyalgia from your conversations and experiences. So yes, thank you once again, and thank you to our viewers as well.